the reason why we wanted to look at this study was, we wanted to know the impact for people when they switch their medicines from tenofovir disoproxil over to tenofovir alafenamide. And we knew some things from the clinical trials, but there were some things that we thought were missing. And in particular, we thought that changes in weight or BMI might be an interesting thing to take a look at. We had certainly seen in our clinic, at least we thought what we saw were some changes in weight after people changed their regimens. Maybe it was the integrase inhibitors, but maybe TAF was playing a role as well. And we also saw considerable changes in cholesterol. And we wanted to know what the impact of those changes were. Did it change people's actual risk for cardiovascular disease? And so we looked at individuals who had switched from TDF to TAF and didn't change any other component of their regimen. So in the year prior, we collected all of their data in terms of their cholesterol, their weight, BMI, etc. And then they switched to TAF, and we collected that same data in the year after. We did a pre and post analysis and found that there were significant changes in both weight and BMI. There was a modest change in BMI of about 0.5 kilograms per meter squared, but even a small change could be relevant for someone and could impact things like their risk for cardiovascular disease or diabetes. Maybe more importantly, we did see considerable changes in cholesterol, and those changes in cholesterol did correspond to an important change, I think, in their ASCVD risk, or their atherosclerotic cardiovascular disease risk. When we did the calculations prior to their switch to TAF and then after, we saw on average about a 13% change in that risk score. And that moved a lot of people from really not needing a medication like a statin to reduce their cholesterol to now qualifying for that medicine. And so, the implications of that are important, I think, to our clinic patients, and it's something that we're paying close attention to now in every patient that we switch from TDF to TAF.